Dear viewers, welcome to another episode of House of Wellness. We have with us once more Dr. Nilesh Shah, who's a leading authority in the field of mental health. He's a distinguished psychiatrist with an illustrious career spanning over more than 30 years. Currently, Dr. Sahab, head of the Department of Psychiatry, as well as professor है और साइन हॉस्पिटल में practice करते हैं. Welcome, doctor. Welcome to House of Wellness again.
Thank you.
पैनिक अटैक मतलब क्या, उसमें क्या सिम्टम्स क्या होते हैं?
Okay. So एंजाइटी के पेशेंट हमारे पास आते हैं वो दो तरह के होते हैं. एक के जिनको कंटिन्यूअस 24 घंटे माइल्ड एंजाइटी होती है. क्या होगा, कैसे होगा, मैं एग्जाम में पास होऊंगा कि नहीं, व्हाट आई विल डू. सो दे आर ऑलवेज एंशियस ऑन द एज. And usually it is predominantly mental anxiety, in the sense negative cognitions, worried about anything and everything.
Okay.
So that is what we call generalized anxiety disorder.
Okay.
As opposed to that, some people get acute attack of severe anxiety, which we call as a panic attack. Because it is not continuous. Suddenly you are sitting and out of blue, you get a severe attack of anxiety where you have 4 different types of symptoms. So one group of symptoms, majority will have cardiac symptoms, heart symptoms. So they get palpitation, pain in chest. So as if they are going to get a heart attack and they have to immediately rush to a doctor, thinking that that person is getting a heart attack and he will have to be admitted in the hospital. So that is cardiac symptoms. Second, they have respiratory symptoms. So they have difficulty in breathing and choking sensation. And they feel that they are not able to take breath. The third is what we call GI symptoms or gastrointestinal symptoms, butterflies in stomach, and suddenly uncontrollable urge to go and pass urine or stool. And the fourth is CNS, yani brain symptoms, where they feel little giddy or blackout or they kind of faint. So most common in panic is palpitation and difficulty in breathing and choking sensation, and what they classically describe as a fear of impending doom. And severe fear, and that attack starts suddenly out of blue at any time, anywhere, and it would last for about 8 to 10 minutes, sometimes a little more than that, and then automatically subsides.
अच्छा, तो डॉक्टर साहब उसमें सिवियर पसीना भी आता है?
हाँ. Severe, they can have restlessness, severe tremors, stammering, severe perspiration.
ओके. तो अगर ऐसे सब सिम्टम्स देखने को, अगर किसी somebody sees symptoms like this, तो what is the next step? क्या करना चाहिए उनको?
So see, initially what happens that they immediately go to the hospital, and they feel that they are having a heart attack. Immediately the doctor on call will do the cardiogram, and suppose there is some mild disturbances in cardiogram, he will be admitted in intensive cardiac care unit, and he will be monitored for 1 or 2 days. They will do the enzymes, etc. Now, after doing all these things, the doctor should tell them that you don't have a cardiac problem, but this was a attack of panic. So you had a panic attack, and go and consult a psychiatrist.
Okay.
Now, unfortunately, what happens that majority of the time doctor says you don't have any problem.
Okay.
And patient usually recovers in 10-15 minutes. By the time he goes to the hospital and then all this thing is done, he is absolutely fine. And then relatives will, usko to kuch bhi nahi hai, his all investigations are normal. So they come back, and after say 1 week, 2 weeks, a month, suddenly he gets another attack. And again they rush to the hospital and they find that everything is normal. And again doctor will tell the same thing, that you don't have any problem. Instead of saying that you don't have a cardiac problem, you have a panic disorder, consult a psychiatrist. It doesn't happen that way. And then the consultation starts. So then they go to cardiologist, then chest physician, then gastroenterologist, then neurologist. And everybody says, you don't have a cardiac problem, you don't have a chest, pulmonary or lung problem, you don't have a brain problem, you don't have a gastrointestinal problem, stomach problem. And then relative starts feeling that he is doing natak, means he is only putting up the symptoms. Aap itni chinta kyun karte ho? Why are you so anxious? Why do you all do all these things? You don't have anything. Without realizing that there is a disorder, well-defined psychiatric disorder called panic disorder. So finally, and we had done one study that from the first panic attack to they come to a psychiatrist, majority of the patients spend 2 years.
Oh my God. Okay.
So they go from pillar to post, and panic attacks you may not get every day. You may get once in 15 days, once in a month, sometimes once in 2-3 months. So then it is ignored, and finally when the frequency increases to once or twice a week, then they become alarmed, and finally somebody would say go to a psychiatrist, and they come to a psychiatrist. Once they come to us, we make a correct diagnosis saying that yes, you don't have cardiac problem, you don't have lung problem, you don't have any other body or physical disorder, but you have a well-defined psychiatric disorder called panic disorder. And anybody in the world can develop this panic disorder. So the way 5% of the people develop anxiety disorders, 5 out of 100. Similarly, the another associated problem with panic disorder, which majority of the time goes hand in hand, is called agoraphobia.
Okay.
So that is fear of going to a place where escape is difficult or getting help is difficult.
Okay.
So they develop a phobia.
So
So they will avoid staying alone at home, because in case they get panic attacks, there is nobody to help them.
right.
If
Okay.
they go to a closed space like toilet or a bathroom, they don't want to close the door, because if they get a panic attack, who will open the door? Or suppose they kind of faint, who will open the door?
So it is
They,
different from claustrophobia.
yeah, that is also called claustrophobia. That is fear of closed spaces. And there also fear is that if I enter the lift, nowadays it completely closes. And suppose I get this panic attack inside and the lift is going, you can't suddenly stop the lift.
Right.
So they avoid going into the lift. They even if they have to climb 10 staircases, if they have to go on 10th floor, they will climb the staircase, but they will not enter the lift. So claustrophobia is fear of closed spaces and also fear of crowded places. Agoro or agora means marketplace.
Okay.
So in the olden times, 200 years back, the only place which was crowded was a marketplace. And these women would fear and avoid going to marketplaces, because if they are in crowded places and if they get a panic attack, getting help or reaching back home will be difficult.
Okay.
And then they will become housebound. So it was called as housebound housewives.
Oh, okay.
So syndrome of housebound housewives, that those women who remain in the house all 24/7 and fear going out alone. Because if they get a panic attack, who will help them? Suppose they collapse, who will help them? So they will remain in the house, and if at all, if they have to go, they will go only with someone, with some senior member who will help them in case if they get panic attack to come back home.
Okay.
So basically, it's acute episodes of anxiety, which can last for 10 to 15 minutes and then subsides by itself. It can occur anywhere at any time. It can occur in house, it can occur in lift, it can occur in theater. Theater is all dark and closed space, so they also avoid going to the theater. It can occur in train, it can occur in flight. So people avoid flights because if they get a panic attack in the flight, they can't stop the flight and get off the flight. They also avoid traveling by long distance train.
Okay.
So those are the restrictions which they have to face.
Okay. And then what about the medication? Are they very long?
So